Welcome. My name is Brent Murphy. I'm the founder and president of RTU. Why would you select RTU? Right now we're going to talk about basically the graduate program in medical physics. Our curriculum follows Task Group 197. AAPM Task Group 197 has outlined what the important features and content of a full and thorough program would be in medical physics. We meet those guidelines. We're excited about that. The CAMPEP guidelines talk about what's important, what should be delivered, how it should be delivered. It's great content between the task group report and the CAMPEP guidelines. That's what we follow as our base and our foundation. Another reason, our faculty is clinical. They're leaders in the field. They've been in the trenches for 5 years, 10 years, 30 years. They've seen the changes. They know what's important as far as instruction at the fundamental level, building the foundation, and introducing all the clinical changes, all the new technologies, and tying the academia, right, with what's out there. We've taken a unique dynamic delivery approach. I like to call it a hybrid approach, right? It's a blended instructional approach that not only do we have classroom instruction, but we also have virtual training. Okay, virtual online instruction that basically is login and password protected. We do a lot of neat things in the aspect you can watch the lecture virtually, and then you can attend the classes where part of the lecture may be given, but a majority of time is spent on studying and discussion and answering questions from that virtual component. Right? It maximizes out the efficiency. In a way, it optimizes, right, the educational experience. This has been proven by not only medical centers, if you will, or medical universities and colleges internationally, but also by some medical physics colleges or universities, if you will, in Europe. Right? Now the U.S. has embraced, if you will, and is doing feasibility studies evaluating this, and the preliminary outcome, right, the preliminary data is this is a good way to teach. So how do you get into RTU? What are the prerequisites? Right? We looked at 3 of the leading graduate programs and basically took a hybrid, right, a mixture of their prerequisites. You got to be a strong student. You got to be passionate. Right? You may not be in the field. You may be an engineer or a physicist. You may be somebody that's in the field, a medical dosimetrist that's hungry. Okay? So the most important thing is that you're hungry and you're passionate. Okay? The American Board of Radiology is requiring that you have this sound foundation in physics before you sit for your certification examination. Right? Why is that important? They want to build that foundation. They want you to be well versed and diverse. So we offer those courses. We offer the calculus-based physics courses. We offer E&M, quantum mechanics, atomic and nuclear physics, thermodynamics. Okay? It's very important to have a good understanding. We've got dynamic faculty that take this difficult content, right, and make it interesting so that it becomes a positive learning experience. RTU has a lot of relationships with a lot of the vendors, with a lot of large cancer groups, if you will, as far as cancer centers. What does that do? That creates opportunities. That creates opportunities for residencies. That creates opportunities for employment. For the past 10 years, Advanced Radiotherapy Consulting, ARC, right, has been providing education and training to over 2,000 individuals that practice in our field. Those may be clinicians, right, radiation oncologists, medical physicists, medical dosimetrists, radiation therapists, nurses, admin people. All right? Growing that passion as far as training and education that ARC has set the standard for has only become a positive for RTU. In closing, if you're passionate about learning, you're passionate about a challenge, you're passionate about a job that changes from day to day where you can help cancer patients' lives, and you want to make a difference, you want to make a difference in this field of medical physics, we welcome you to accept that challenge. We accept the challenge to put out the best didactic and foundation and fundamental information in the field of medical physics tied with all the new clinical technologies that are coming out. To learn more, visit the website, right? Give us a call, do a deeper dive, and we welcome you to RTU. Thank you.